Barbara Courager.
Mr Speaker, this private member's bill that we're speaking on tonight, the intention of the bill would be to provide 3 free doctors' visits to people over 65, which in itself is commendable, but it is very unnecessary and very expensive. Because actually, over the next 10 years, one of the challenges facing the public health service will be the increase in population aged over 80 years of age, and the member Dyson stood up before and she said that our esteemed chair of our select committee said that these people don't need to be supported. What our chair of our select committee actually said was that these people are being supported anyway, because under this government, those over 65 who struggle to pay to go to the doctor are already supported. And as he also said, that is the group that is less likely to be deterred from going to the doctor. We need to be more supportive of our younger people. And let me tell you that given 80% of the people who are over 65 now are actually going at least 3 times, it's unlikely to significantly increase the GP visitations or decrease any hospitalisations. And so when we think in the context that over the next 10 years we're worried about the costs of people over 80, imagine how much that's going to increase the cost to the system. And I actually don't think, despite the fact that you can retire at 65, that actually some people who are well over 65 are actually quite fit and healthy. And on Monday, I was actually out and I did a volunteers day out in the electorate with a number of different groups, and part of that day I did Meals on Wheels. And the couple who so kindly offered to take me out and around to do Meals on Wheels were celebrating on that very same day their 58th wedding anniversary. And here they were actually out delivering on Meals on Wheels, and they were going to a Lions meeting that night. And I can't thank the elderly people enough in our community that get out and they volunteer and they care for each other. And that actually in itself gives them the company, actually keeps them fit and healthy. And I've also had another man in my electorate who's 80, who says to me that he used to drive the elderly people to their medical appointments, and now he's actually driving his peers, and it's an honour for him to be able to get out and do that. So look, for those who struggle to visit a GP, there's a wide range of support available, and that includes high user health and community services cards. It includes a pharmacy subsidy card. And this policy, as our select committee chair said, is likely to cost between $64 and $100 million, but that actually doesn't include administration costs, it doesn't include after-hours GP, and it doesn't include prescriptions. And even the New Zealand Medical Association Chair, Dr. Mark Peterson, said the policy is unnecessary and difficult to justify. And he went on to say, and I'll quote, "We need to target increased funding to those who really need it, those people who can't afford to go to the doctor in any other way." And as we said before, 80% of those people are going to the doctor anyway. So in terms of healthcare, I think this government's doing pretty well. I think we are supporting those people. We've also put an extra $76.1 million in the next 4 years to go into palliative and hospice care. We've increased spending on aged residential care, and it's really commendable, I think, the work that's been done in this area, and also the number of hours of home support that are going in now have been lifted from 9.3 million up to 10.9 million in 2014-15. So that is prevention. That's communities looking after themselves, and it's actually people taking care of each other with support from our government and helping them lead a long, healthy, sustainable life. Thank you, Mr. Speaker.